Eczema is more of a broad term. It's more of a generalized term. Eczema just means irritated, dry, itchy skin. But normally when people say eczema, what they really are talking about is a condition called atopic dermatitis, which is a triad of conditions usually that has to do with, skin conditions, breathing conditions like asthma, and also just regular allergies. Atopic dermatitis, basically the inability for the body to retain its moisture. So it's really about moisturization and adding moisture to the skin because you can't keep it there yourself. A lot of people want to think that food allergies play a role, but in reality, less than 1% of patients actually are affected by food allergies. Taking care of yourself is always a good thing, and trying to avoid stress because it will worsen the condition even though it doesn't cause it. It's very common for children with eczema to scratch a lot, and especially if they're very young, you can't control the amount of scratching that they're doing. So commonly they get secondary infections like bacterial infections, staph infections, viral infections. A lot of teaching about what you need to do, what you need to avoid, and the correct types of moisturizers. Use ones that don't have fragrances or dyes. Free and clear detergents. We recommend, soaps that don't smell, but also don't irritate. And that's probably the hardest part. Nobody wants to give up their products. The length of showering, shortening it, not having real hot water because that's going to stimulate histamine and make you more itchy, so that's going to worsen it. And we just say to avoid all fabric softeners, altogether. If you have eczema or atopic dermatitis, you have a hard time holding on to those lipids. You want some moisturizers that have ceramides. Ceramides are lipids and you're replacing it to the skin. The best time to moisturize is right after the bath or shower so that you still have a little bit of moisture in your skin. We do use steroids to treat the skin condition there. Sometimes oral, but we usually try with topical first. So with the topical steroids, it's used to treat an episode. So with these topical steroids, they're safe if they're used correctly. They just can't be used every day long term, and if you're using it on a small child widespread, they can have some side effects.